Well, good morning. Since late October, as we talked about on Tuesday, we've been experiencing a surge of new COVID-19 cases that has driven our positive rate and hospitalizations up significantly. Iowa is not alone. States across the country are experiencing much of the same. Since November 1st, more than 37,000 new cases have been reported at an average positivity rate of 21.8% statewide. New cases were primarily among adults, 23% among adults ages 18 to 29, 16% were among adults in their 30s, 15% were in their 40s, and 14% were in their 50s. Older adults in their 60s, 70s, and above the age of 80 accounted for a combined 20% of our new cases, and 11% of the cases were among children under the age of 18. While the highest number of new cases continues to be in our most populous counties, smaller rural counties are far exceeding them when we compare cases by population per 100,000. Since November 1st, Polk County has had the highest number of cases at 4,486, which equates to 921 cases for a population of 100,000. When you compare that to Pocahontas County, which had only 143 new cases, but which is the equivalent of 2,122 cases for a population of 100,000. We're seeing significant community spread across our entire state, both in our metro and rural communities. COVID-19 does not discriminate based on geography. The virus is present in all of our communities, and all of us can help stop its spread. Yesterday, 1,208 Iowans were in a hospital due to COVID-19, accounting for 21% of all hospitalizations statewide. While 215 COVID patients were in ICUs, another 334 ICU beds were open and available. 101 patients required the use of a ventilator, which accounts for just 25% of the ventilators that are available statewide. We continue to closely monitor hospitalizations throughout each day to ensure that resources remain stable. Recent news coverage has warned Iowans that hospital beds in some areas are full, suggesting that people may not be able to receive care. My team and DPH is in regular contact with health systems and hospital leaders, and they assure the team and me that that is not the case. While hospitals are experiencing sharp increases in patient volume due to the impact of COVID-19, they still are accepting patients. In fact, most hospitals are continuing to provide elective surgeries, although some have scaled back to open beds for more patients as needed. Reducing elective surgeries is one way to expand capacity when necessary, and hospitals are monitoring that closely on a daily basis and postponing some scheduled procedures. As we've known from the beginning, COVID-19 has the most serious impact on the health of older adults and people of any age that have pre-existing conditions, and we see that reflected in our hospitalization numbers. Older adults continue to experience more serious illness requiring hospitalization. Currently, 72% of COVID-19 hospitalized patients are age 60 and older. 23% are 60 to 69 years of age. Another 23% are age 70 to 79, and 26% are 80 or older. 12% of hospital patients are in their 50s, 7% in their 40s, 5% in their 30s, and hospitalizations are extremely low among children and younger adults. Currently, only 1% of hospital patients are under the age of 18, and another 1% are ages 18 to 29. Because of the significant increase on hospitalizations at this time, we will be updating the hospital data reported on coronavirus.iowa.gov to include the age demographics of currently confirmed COVID-19 hospitalizations. The new data will also include a breakdown of daily hospitalizations by age since July 23rd, when this data was first required to be collected and reported to the U.S. Department of Health and Human Services. The age groups will also be categorized differently, primarily by decade, with the exception of children, which will remain defined as 0 to 17 years of age. These new categories will offer more specific information, not only about hospitalizations, but new cases as well. The age group change will be applied across all data on the site where age is reported. Additionally, information is provided for hospital patients by day who had either a primary or a secondary COVID-19 diagnosis. So a primary diagnosis means that the patient's COVID-19 illness was serious enough for them to require hospitalization. A secondary diagnosis means that the patient was admitted to the hospital for a different reason, but tested positive for COVID-19. This new data is intended, again, to provide additional context to help Iowans understand more about the impact of COVID-19 and the risk to specific individuals. The current RMCC data will continue to be provided on the site as well, and the update will occur, those that I just spoke about will occur this evening. So as we discussed on Tuesday, the surge in new cases has prompted some schools to consider temporarily moving to a different learning model, whether that means moving from full-time in-person learning to a hybrid model, or requesting a waiver that allows virtual learning for a period of time. I've again asked Director Lebo to join me today to provide a further update. Ann?
Thank you, Governor. Since Tuesday, we have received 19 waiver requests to provide primarily remote instruction, all of which were approved. A total of 43 districts and non-public schools are currently operating with a waiver, representing 9.6% of Iowa schools. All waiver requests and supporting documentation are available on our website as soon as they are processed. On Tuesday, we sent out some important reminders to superintendents about remote instruction and the waiver process, and we have scheduled a webinar for Friday to help clarify all the options available and answer any follow-up questions on the recent proclamation and the impact it may have on their school activities. To support school leaders in making the best decisions for their districts, we want to make sure we continue to make Iowa Department of Education resources and advice available in as many ways possible. Because requesting a waiver is just one option for schools, and there are many adjustments schools can make without needing additional approval from the department, we continue to encourage schools to contact us to help them work through solutions. We know that sports and activities play an important role in our schools and communities, so we are also working with districts on options that allow them to do what is best for the students and the families they serve. To our school administrators, again, if you have questions about how to do what you have determined is best for your community, please reach out to us so we can help you find the best path forward. Thank you.
Thank you, Ann. I appreciate everything you and your team are doing to help schools navigate these important decisions. So today, Test Iowa sites are back open after being closed for Veterans Day, and each site has added 200 more appointments to their daily schedules. The 5 state-operated drive-through sites can now test a combined 4,040 Iowans daily, Monday through Friday, or 20,200 each week. 1,000 appointments will be available at the Des Moines site, 840 each at the sites in Cedar Rapids, Davenport, and Waterloo, and 520 in Council Bluffs. When combined with the clinic sites and the university and college partnerships, Test Iowa has generated more than 6,000 tests a day, proving to be a valuable asset in our state's response to COVID-19. Nearly 400,000 Iowans have used Test Iowa since the first site opened on April 25th. That's 37% of all Iowans tested in our state. Over time, we've continued to increase capacity, not only at sites so we can serve more people, but also at the state hygienic lab so that more tests, which is an important component of this, can be processed more quickly with results reported in less than 24 hours at some times. Even now, there are still states that struggle with testing capacity, and we're extremely fortunate to have the strong public-private partnership with Nomi Health and our team at the State Hygienic Lab, and it's important that it continues. As you know, our contract with Nomi Health ensured the delivery of 540,000 COVID-19 test kits at a time when testing supplies were scarce and in high demand across the country. We've received all of the tests that we contracted for, and we have approximately 140,000 remaining, which we anticipate the supply will take us through December 11th. Because our contract with Nomi Health extends through April 2021, we have amended it to include the purchase of 360,000 additional sample collection kits for the Test Iowa program. The collection kits are the same that are currently used and include the swab and vial needed to collect and store samples that are transported from each site to the lab. Each kit also includes a barcode that uniquely identifies the sample and matches it to the individual tested. And this is how each sample is tracked through the entire lab process, and also what enables us to report results back to individuals electronically through the Test Iowa system. Each kit cost $9.50 for a total of $3.42 million. That equates to about $1.08 per Iowan to enable Test Iowa to continue operations while testing remains a critical component to the health of our people and our state's recovery. The PCR test, which is used at the lab to process the samples, will now be supplied by the State Hygienic Lab at a cost of $19.80 per test through the lab's existing contract, which means that the state's cost to test every Iowan that comes through a Test Iowa site is just about $29.30, and we believe that's well worth the investment. Earlier this year, when there were shortages in the testing supply chain, we contracted with Nomi Health for both the collection kit and the PCR kit for the Test Iowa program. But now that the supply chain has stabilized and strengthened, the lab can use the same type of test kit for all molecular tests, including Test Iowa, which will create even greater operational efficiencies at the State Hygienic Lab, further adding to the value of Iowa's testing strategy. On Tuesday, I announced additional mitigation measures that are now in place to help us flatten the curve and get COVID-19 to a level we can manage while continuing to move forward with life. Each of us has the ability to make a difference over the next few weeks, and I believe we all want the end of this month to look a lot different than it did when it started. And together we can make that happen, and we must. Finally, I want to congratulate Iowa's high school football teams for a season well played, especially those heading to the Dome to compete for a state title. It's always a privilege to make it this far, but never has it meant more than it does this year. The tournament provides a sense of normalcy for the athletes, coaches, and families who've worked so hard to get their teams thus far. You've had the opportunity to play, and many teams across the nation have not, so we don't want to take that for granted. I'm asking you all to do your part to practice and play safely, and for families and fans to be responsible spectators. The University of Northern Iowa and the High School Athletic Association have gone to great lengths to provide a safe environment for both players and fans, including capping capacity to better enable social distancing, requiring masks in the arena and on the concourse, and doing additional disinfection throughout. Please follow the guidelines in place at the Dome, and if you go to the local restaurant, a bar, or store afterwards, continue to practice the public health measures that will protect you and others. And while you're working hard to win your games, let's not forget that together we have an even bigger battle to win, and there's no victory more important than the one against COVID-19. So be responsible, play hard, and enjoy the opportunity. Make us all proud. And with that, I'll open it up for questions.